signs, symptoms diagnosing TTP. Abdominal pain. Abdominal symptoms are reported frequently prior to diagnosing TTP, especially abdominal pain. Those symptoms most probably represent blood flow disturbances, ischemia, in the bowel or other organs in the abdomen. There are also cases of abdominal pain due to pancreatitis and TTP. On some occasions, an enlarged spleen dealing with an increased amount of destructed red blood cells can also cause abdominal pain. Diarrhea can occur but is usually more typical for other thrombotic microangiopathic diseases. Headache. Many patients have minor neurologic symptoms like headache or dizziness that vary greatly in severity. Those symptoms can advance rapidly to more obvious or serious neurological manifestations such as paresthesias, abnormal sensations such as tingling, tickling, pricking, dysarthrias, motor speech disorder, seizures, paresis, weakness or partial loss of voluntary movement, and coma. Those symptoms represent the consequences of disturbed blood flow in the brain, microthrombi in the vessels, causing ischemia with stroke-like symptoms. Fatigue. Fatigue, weariness, weakness, exhaustion, mainly derives from low red blood cell count, anemia. Sometimes it is accompanied by higher heart rate, pulse, because the heart tries to compensate for the lower oxygen transport capacity by increasing the turnover of blood. Due to the destruction of red blood cells and the breakdown of released hemoglobin, a yellow compound called bilirubin is increasingly produced and can cause yellowish pigmentation of the skin and the eyes, jaundice. Skin bleeding. Because of thrombocyte consumption in clot formation in the microcirculation, there are less thrombocytes available for the coagulation process and sealing of small cuts in the vessels. Therefore already small, sometimes unrecognized trauma can cause bleeding under the skin, bruises. Typical signs of skin bleeding in TTP are petachiae, which are small pin-sized dots in red or purple in color. Purpura consists of multiple petachiae, sometimes a little bigger in size, 3 to 10 millimeters. They are non-bleachable, which means when the skin is pressed, the redness doesn't go away. Fortunately, severe bleeding is rare in TPP, most probably because the function of the remaining thrombocytes is preserved. Another often reported bleeding sign in TTP is red urine, hematuria, or menorrhagia, menstrual periods with abnormally heavy or prolonged bleeding. Dyspnea. Dyspnea is mainly due to accompanying anemia, but can also indicate heart involvement. Anemia means reduction of the number of red blood cells and lower concentration of the red blood pigment called hemoglobin, which transports oxygen through the body. Some might recognize additional signs of anemia like paleness of skin. Anemia is caused by the destruction of red blood cells when those cells flowing in the bloodstream fight against clotted small vessels or fibers of ultra-large multimers of von Willebrand factor. Anemia caused by the destruction of red blood cells is called hemolytic anemia. In TTP you can usually see destructed erythrocytes under the microscope, so-called schistocytes.